My name is Seid Mohammed. I am the lead member of MMRTI Multimedia Resources and Training Institute. And today we have Dr. Maxell, and we'll talk about mental health, especially for young people. Starting this conversation, I would like to say welcome, Dr. Maxell.
Thank you.
And also thank you for accepting our invitation. And we have like some couple of questions which are asked by some teens and some young people concerning especially about this COVID-19.
Sure.
First, I would like you to introduce yourself to our audience.
Sure. So I'm Dr. Maxell. I am a behavioral health specialist in Everett, Washington. I also am a professor at two institutions here in Seattle, Washington, and I own a private practice doing work in-home with youth and families.
Thank you. And so some of the questions are like, can you tell us about mental health and its implication, especially on the current COVID-19 pandemic and critic time?
Sure. So mental health challenges seem to be on the rise, especially through COVID-19, because more people are staying at home. People are either working from home or unable to work because of businesses being closed down or shut down due to the coronavirus. So it's making it very challenging for people to feed their families or take care of bills and go on with their everyday lives. And what we're seeing is a lot of anxiety and depression and questions about the unknown, about what's going to happen next. So it's really important right now that we just raise awareness of what people are experiencing and ask questions about what their needs are and try and provide as best as we can.
And especially at this time, because of COVID-19, schools are closed and everybody is working from home. And what do you think about the closure of schools and online classes? And what are the things the students should know to keep their mental health well and positive?
So with schools being closed right now, I think it's really hard for parents and for families and for children, college students, anyone who's enrolled right now, simply because it's a disruption in the everyday schedule. Parents are used to having their children at school. I know my kids are having a rough time not being in school right now and having to switch to an online format. So it's difficult, but I think schools are trying to do the best that they can given the situation. It's important for students to keep a very structured schedule if they're able to, depending on their circumstances. Not everyone is afforded the same types of resources or time, depending on who's in their household or access to whatever technology they need for their courses. But it is really important to try and maintain a semblance of structure that is like the school day, which also means taking breaks, taking time to do things that are not school related. And then for individuals who are in the independent learning process, to make sure that you pace yourself and that you are attending to the coursework, that you're not falling behind, that you're making sure that you are taking care of your own physical and mental wellness, because that can affect your productivity overall.
And since everybody is staying at home and there is family gatherings and every family members are together, and so do you think staying at home has negative effect within family relationship, and for example like between parents and their kids, or between spouses like husband and wife? So is there any negative impact because of this COVID-19?
So I think outside of COVID-19, sometimes being in one another's space for too long can have some negative impacts. But it really depends on how a family works together. What we have seen is an increase in the number of domestic violence cases and child abuse and neglect cases, which is highly unfortunate, and we definitely need to attend to those needs. And specifically with social services not operating at full capacity, mental health clinicians, kind of being maxed out in terms of the resources and trying to just attend to people's needs, it makes it very difficult right now. But we are seeing some negative implications with being at home. All the time people are going a little stir crazy. There's lots of anxiety. There's really not a lot of options for people to engage in right now. But it is really important that families find a way to make the best of the circumstances. So, playing board games, taking breaks from one another. If there are separate rooms in the house, that people kind of go to separate rooms for a little while. And once again, kind of going back to your question about students and online courses, making sure that the day is structured, that there is some structure to the day, that there's some sort of predictability that makes it a little bit easier for families to function. But yes, we see lots more arguments between siblings, and then between husband and wife, depending on, if they were both the breadwinners or if there was one that was a breadwinner. There's a lot of stress that's been going, that's been talked about because of COVID-19. And we've seen this before at the coronavirus pandemic. And I think this has just made things a little bit worse.
And there is also, as like language barriers and cultural barriers, living costs and educational levels that affect different families, especially low-income families. And what positive or mental activities or how do they increase the positiveness of their mental activities to make their life normal?
Mm-hmm. So I don't know how I feel about the word normal. I think normal really depends on the family and how the family defines that term. But in terms of just preserving a sense of positivity or, maintaining a sense of wellness for the family, there are so many resources that are available right now. They might not be attainable by everyone, but there's online resources. We can go back to playing board games. We can go back to just having good conversations and writing and such. And not everything necessarily, is just for English speakers. There are, cultural traditions in families that can still be preserved even through COVID-19. And while this is very challenging and the cost of living is, still steady on the rise, and this has definitely messed with people's livelihood, there are still things that are relatively inexpensive or where people don't have to pay to be able to maintain their own sense of wellness. So, yeah.
And we did some survey with some things through some online meetings, and especially my friends and other young people. And they said sitting at home increased the depression and anxiety they had. And how do you express this based on mental health or behavior?
So I think I would definitely agree that, staying home and feeling as if you're trapped would increase the feeling of those symptoms of depression and anxiety. But I know my kids use video games as an outlet, or they'll find ways to talk to people through FaceTime or by Skype or Zoom, and still find ways to connect. And it's not the same, but it is an outlet. So finding even, that silver lining, even when there's the storm, the ability to, cook a special meal or do something with your family, or, engage in something that you really love to do as a youth, is still going to be very important in this time. And it's important that, you're doing something to contribute to your own wellness every single day.
I agree with that, especially. me sitting at home and I have, but yeah, but to end our conversation, uh, what advice do you give to the students and parents to create good and positive relationships at their house during this pandemic and especially generally anytime?
Once again, I think that's going to go back to the culture of the family, but I always believe in just talking to one another, having a conversation with one another about, what's going on, being honest, being vulnerable, making plans to do things that are not related to the COVID situation. So, not watching the news, sometimes turning the news off, maybe watching a funny movie, listening to a favorite song, taking this time to connect and bond in ways that perhaps we took for granted, that we weren't able to do prior to the COVID situation because of work schedules, because of all these other barriers. It's really taking the time to just connect with one another.
And I would like to take the chance to say thank you to our audience and thank you, Dr. Maxell, for coming here and giving us information about this, how to deal with mental health. And have a good day.